Hi, I'm Dr. Joel Cohen at About Skin Dermatology and Aesthetics, a world's leading clinic. When I see people for consultations and discuss the cumulative effects of sun exposure and age-related changes and gravity, we go through 6 main issues. 1, overactive muscles. There's certain areas on the face, such as in between the eyebrows or in the crow's feet, where when we contract these muscles, they can imprint lines. So that's where we use Botox or Dysport or other neuromodulators. So essentially what's happening is that the injection of the neuromodulator gets to the point where it prevents the nerve from stimulating the muscle so that the muscle's more in a relaxed state for 3 or 4 months and doesn't imprint the lines any further. 2 is volume loss. So what happens over time, sun exposure degrades collagen. We also know it creates laxity to some of the ligaments and structures in the skin, and gravity takes effect. So we see some descent in the face. So some of the fat pads that sat up here are now down here. So what we do is we try to re-inflate very specific areas by using fillers, which are soft tissue augmentation agents. And we try to do it very precisely. So we put the right amount in the right areas, and that's agents like Restylane and RHA. And these are injected into the skin with a little topical anesthetic, so you feel very little as far as a needle stick. Number 3 is discoloration. So a lot of times we see people who have pigment or redness or both. So as far as pigment, when we look at areas of pigmentation, we want to make sure that the freckles or the larger freckles we call lentigines are uniform in color and have a uniform border. And those we actually treat with lasers like a Q-switched or a pico laser, or we can use light like broadband light, and that actually effectively targets the area of pigmentation, temporarily making it a little darker for a few days. It can take a few treatments to see improvement, but that can actually really clean up a lot of that sun damage and pigmentation. Other types of discoloration are redness. We see this oftentimes in fair-complected people, particularly people who may have rosacea, which is a condition where people have red patches and vessels that are more visible on the face, and they tend to flush more easily. And for that, we use vascular lasers. So there's a laser called KTP or XLV Plus that works great for these areas, or we can use a pulse dye laser. Not particularly painful. People are a little swollen for a day or two, and that works really well for decreasing these areas of redness. Number 4 is etched lines and wrinkles. In particular, we get this around the mouth and around the eyes. Around the mouth, people often call it the barcode. So to really try to minimize the appearance of these lines that are deep into the skin, we tend to use ablative resurfacing. Ablative means wound. So basically we're using the laser to vaporize the surface of the skin or to fractionally vaporize the skin that we can go deeper. And that actually is really helpful in effacing some of these etched lines. The 5th issue is really dullness and roughness and sun damage to the skin. So this is one of the effects of significant sun exposure. And what we do for this condition is really try to use the lasers that don't have downtime, that are still resurfacing lasers, like fractional non-ablative lasers. So instead of vaporizing the skin like a ablative laser, it actually uses the laser beam to coagulate the skin. That helps replace some of the areas of the collagen with newer, fresher collagen, which can help turn over the skin. So we know that by using these lasers, we can improve the light reflection of the skin, the roughness of the skin, and now it's been shown that even some of the pre-cancer changes and some of the changes that happen over time that can lead to skin cancer get better. So when you do some of these laser procedures sequentially, you can actually see a reduction in non-melanoma skin cancer, basal cell and squamous cell carcinoma. The 6th issue is really skin laxity. So a lot of times people come in and they have really significant jowling, and there's no treatment or energy-based device that's going to actually give people that much improvement. So when a patient is coming in and they're doing something like this, it's appropriate to send them to a plastic surgeon because they really need to have surgery. If you think about what they're going to be happy with, if they have significant jowling, significant laxity, we expect surgery to be very effective, and oftentimes it's going to give you a report card of an A- or potentially even an A. But when we think about some of the energy-based devices out there, they're often used for people who have more mild changes. So mild or more moderate changes are things that we can use energy-based devices like ultrasound, like radio frequency, or we can combine ultrasound and radio frequency. We do have energy-based devices. Typically, these are not painful. Typically, these don't have downtime, but sometimes patients really who have more significant areas of laxity and jowling do need to really consider having surgery. So at About Skin Dermatology and Aesthetics, we all look at these issues that patients have, and we really focus on what they're most concerned about. So we call it really the signature issue. To learn more about the different skin issues and the ways that we treat them, visit worldsleadingclinics.com.